Hello, my name is Tessa and I'm going to be your student nurse for today. Could you tell me your name and date of birth, please?
Maria Gibbons, 11/16/65.
Okay, Maria, do you have any allergies?
Just seasonal allergies.
And what is your reaction?
Watery, itchy eyes and sneezing.
Would you say these symptoms are mild, moderate, or more severe?
Mild.
Okay. So today I am going to be doing a heart assessment on you, but first I'm going to go wash my hands and then we'll get started.
Okay.
Okay. So to start today's assessment, I'm going to first be checking her heart rate. So I'm going to locate her radial artery and first determine if it is regular or irregular. Hers is regular, so I'm going to count for 30 seconds and then multiply it by 2. Okay, so like I said, her pulse is regular. It is at 70 beats per minute, and it is graded a 2+. While I was doing that, I was also checking her respirations. I didn't want her to know so that she wouldn't alternate her breathing at all. Her respirations were at 14 respirations per minute. Those were unlabored and regular as well. So for the assessment, I'm just going to first take a look at her. So just looking at her, she appears healthy. She appears her stated age. She can sit upright. She has good posture. She remains good eye contact with me while speaking. She appears to have good hygiene, does not appear to be in any distress, and she is alert. So now, for the first part of the assessment, I am going to check her jugular vein. So for this, I would have her kind of be laying back at a 30 to 45 degree angle, and I'm going to have her turn her head to the left. I'm just going to be inspecting, looking at the jugular vein. So just looking at it, I don't see any distension or protruding. There's no bulging of the jugular vein at all, so that is good. And the next thing I'm going to do is inspect, palpate, and auscultate her carotid arteries, both sides. So for this, I'm first going to look at them. I don't see any masses or lesions or anything abnormal. Her skin color is consistent with the rest of her body. So now I'm going to palpate them. So to do this, I'm just going to feel for the pulse. And then I'm going to do it on this side, and I only want to do one side at a time. So palpating and feeling for the pulse on both sides is graded a 2+. They are both strong bilaterally. They're normal from beat to beat. The contour is naturally smooth and rapid on the upstroke, and it is more slow, less abrupt on the downstroke. And I would say her arteries are both pretty elastic, and they don't show any signs of thrills or anything like that. So now I'm going to be inspecting the precordium, which is looking at her heart anteriorly, just on the chest, just looking, not doing anything else. So just looking at her, her chest is symmetric, and the apical pulse is not visible with inspection. No pulsations are observed or anything like that. And so now I'm going to actually palpate the precordium. So to do that, I'm just going to place my palm under its mid-clavicular, right under here. So I'm just going to be feeling for the apical impulse. It is in the mitral area. It's about 1 centimeter. The amplitude is small. The duration is brief. No pulsations or vibrations. I don't feel any of those observed, and I don't feel any heaves or thrills that are evident. So next, I'm going to actually auscultate the heart. So I'm going to do this using both sides of my stethoscope. The first side I'm going to use is the diaphragm. So for this, I'm going to be going from side to side and then kind of down this way and to the left. This is how I'm going to measure the heart. I'm going to start at the aortic valve, then go to the pulmonic valve, then to Erb's point, the tricuspid valve area, and then the mitral valve area. So to do that, I'm gonna use the diaphragm, which is the bigger part of my stethoscope. I'm just going to take a listen. Okay, so I did that, and now I'm going to, or actually, I'll just tell you now. So when auscultating the heart, the S1 and S2 sounds could be heard distinctly at all locations. The S2 sound was louder at the base, and the S1 sound was louder at the apex. These sounds were not accentuated. They weren't diminished. They weren't varying or split. I didn't hear any abnormal heart sounds, such as the S3 or S4. Those weren't heard, and no murmurs were heard or observed either. So now I'm going to do the same thing, do the same positions, but using the bell of my stethoscope, which is the smaller end. I'm just going to be looking for the same things. Okay. Oh, maybe I should twist that so I could actually hear. Okay, and then again, the S1 and S2 sounds were normal and distinct at all of those locations. I did not hear any abnormal heart sounds whatsoever. So now I'm going to be assessing her legs and her feet for any abnormalities, edema, and I'm going to actually also assess her pulses. So for that, I guess I'll be looking at your feet and your legs. Okay, so no, this is fine. We're just gonna do it this way. Okay, okay. So I'm just gonna be looking for any abnormalities, edema. I'm gonna be assessing the pulses, like I said. So just by inspecting her legs and her feet, I don't see any lesions. I can see her other foot as well. I don't see any lesions, ulcers, masses, swelling, or redness. Her skin color is consistent with the rest of her body. Her skin is smooth. Both legs and feet are symmetrical bilaterally. Thank you. Okay. I don't see any edema, pitting, or non-pitting. There's no edema present in legs or feet. The grading is a 0+. Legs, feet, and toes are equally warm bilaterally. So now I'm actually going to palpate the pulses in her legs and feet. So for the first one, I'm going to do is the popliteal pulse, which is behind the knee. So I'm going to do both sides, but this I'm just taking, I guess you can see, just taking my fingers and feeling for the pulse. It's regular. I don't know. It sounded like irregular. Okay, now I'll do that. Sorry. Okay, so in both legs, the pulse is regular. It's a 2+, 70 beats per minute bilaterally. Okay, so now I'm going to do the dorsalis pedis pulse, which is kind of located on the top of the foot. So I'm just going to do the same thing, and I know you can't really see, but just kind of feeling for her pulse. Okay, I'm going to do the next foot. Okay, for both feet, the pulse is bilaterally strong, regular, 2+, 73 beats per minute. And then lastly, I'm going to do the posterior tibial pulse, which is kind of like behind the ankle bone. So I'm sorry, I'm going to have your legs again.
Do you want me to?
Oh, that's pretty good. So it's kind of just behind here. I'm just measuring with my first 2 fingers. Okay, now I'll do the other foot. And then again for this pulse, they're bilaterally strong, regular, at a 2+ of 71 beats per minute. Okay, and then lastly, I'm going to assess your arms and your hands. So again, just inspecting, just looking at her. Her arms are symmetric bilaterally. The color is consistent with the rest of her body. There's no redness or color changes that are observed. I don't see any edema or prominent venous patterning that is present. So just touching her arms and her hands. Her hands are pretty warm. Her skin is warm to the touch, and it's equal bilaterally on both sides on the temperature. And then just taking a look at her nails. Her nails, they're clean. They are pink in color. They're smooth, and they're firm. There's no clubbing or spooning that is evident either in either of her or in any of her nails. So this is the easy part. I'm just going to check the capillary refill time on her fingers. So for that, I'm going to press down on her fingernail and then let go and see how quickly the color comes back. So when I press down, it's a little bit white, and then you're just checking to see how quickly the color comes back, which in her fingers, I'll check the other side too. It is less than 2 seconds bilaterally. Okay, and then one of the last things I'm going to do for this assessment is I'm going to palpate her 3 more different pulses. So the first one is her radial pulse, which I also did in the beginning, but I'm going to do it on both sides now. I'm going to do that on the other side. And this is the radial pulses on the thumb side. Okay, so both radial pulses are bilaterally strong. They are regular. They're at a 2+ and 70 beats per minute. Now I'm going to check both ulnar pulses. So this is on like this side of the hand. So I'm just going to find the ulnar pulse. And sometimes it's a little bit hard to feel. Oh, there it goes. Okay, and I'm going to do that on the other side as well. Just using my first 2 fingers again. Okay, although it took a second to find, both pulses on both sides are bilaterally strong again. They are both regular, graded at a 2+ and 68 beats per minute. And then lastly, I'm going to check her brachial artery, which is kind of like inside of the elbow. So I'm going to check that pulse. Okay, I'm going to check the other one. Checking both brachial arteries. They are equal in strength bilaterally. They are also regular, also graded at 2+ and at 70 beats per minute. So this actually concludes the heart assessment. Do you have any questions for me?
No.
Okay. And I just want to point out that when I was auscultating the heart, I would have done it under the clothing, so I wouldn't get any ruffles or muffled sounds. And that is it.